Last Friday, when it was reported that a 10-year-old girl from Ohio was transported out of the state for an abortion, President Biden had this to say.
Just last week, it was reported that a 10-year-old girl was a rape victim in Ohio. 10 years old. And she was forced to have to travel out of the state to Indiana to seek to terminate the presidency and maybe save her life. That's last part is my judgment. 10 years old.
It was actually terminate the pregnancy, not the presidency. But nothing was said about the heinous act and trauma that led to the pregnancy. Now, there was an arrest made yesterday. Of course, no, the left's not talking about that, but it was an arrest was made yesterday of a 27-year-old man that, according to several media reports, is an illegal immigrant. All right, I bring this up because if the Biden administration succeeds in their efforts to make chemical abortions the new norm, cases like this will be swept under the rug. Additionally, medical experts say women will die from the complications of chemical abortions without medical supervision. Joining me now to discuss this is Dr. Ingrid Skop, Senior Fellow and Director of Medical Affairs for the Charlotte Lozier Institute. Dr. Skop, welcome to Washington Watch.
Thank you for having me, Tony.
All right, you recently worked with Mary Sock here to put together basically a paper that addresses some of the issues regarding chemical abortions. Walk our audience through this abortion method and where things stand today and the problems associated with it.
Yeah, there is so much misinformation about medical abortion. It consists of two pills, mifepristone and misoprostol, and it's been approved by the FDA since the year 2000, but over time, they're progressively taking away the supervision that has always accompanied it. Just recently, using the COVID-19 pandemic as an excuse, they took away all in-person supervision. So what that means is that women can order this by telemedicine, they can order it over the internet, they can get it delivered by mail without ever encountering a doctor. There's no physical examination or ultrasound to determine how far along in the pregnancy the woman is. Because these medications work by cutting off hormonal support and then causing contractions, the further along a woman is, the more likely it is to fail. When it fails, the woman is at risk for infection, she's at risk for hemorrhage, and that tissue that does not pass out has to be removed surgically. Even under the prior recommendations, using it up to 10 weeks gestation, about 5 to 8% of the time it does fail and the woman needs surgery. But in this new world where nobody's even checking to find out how far along she is, it's going to fail more frequently. Some good studies out of Scandinavian countries show that about 40% of the time in the second trimester it fails. Additionally, we've seen a lot of media concern about ectopic pregnancies. Well, the state laws that restrict abortion allow treatment of ectopic pregnancy, but ectopic pregnancy can be a life-threatening condition, and it is impossible to know without doing an ultrasound whether a woman has a pregnancy in her fallopian tube. So giving these chemical abortion pills without supervision means that women will have ectopic pregnancies undiagnosed. The medical abortion does not work on an ectopic pregnancy, and those can rupture, and women have died undergoing abortion when the ectopic was not diagnosed. Additionally, no one's checking anymore for Rh negativity, which occurs in 15% of the population. When that happens, if a woman does not receive a RhoGAM injection, she can form an immune response to her future pregnancies that can cause brain damage and death for future babies. And of course, very concerningly, no one is checking to see if it's really the woman who wants the abortion. Sex traffickers, incestuous abusers, as you mentioned, and even boyfriends who don't want to become fathers can get these pills and they can provide them to women surreptitiously or against their will and cause them to have abortions that they don't desire.
So, Dr. Skop, I have to ask this question. How is this a compassionate approach to women?
Well, it's not a compassionate approach at all. Chemical abortions have 4 times as many complications as surgical abortions. The abortion industry has been teeing this up for some time. Every year, we see more and more higher percentage of abortions are provided chemically. And I think they've been doing this because they recognize that the time would come when restrictions would be put in place as they're being done currently. And they wanted to have the ability to get abortions to women in restrictive states. I'm in Texas. Obviously, there's a big push to promote these pills to women online. And when these complications happen, we're not going to have a very good ability to pick up the complications. All of the data about abortion in our country is voluntarily reported. Charlotte Lozier performed a study where we bought Medicaid data from 17 states that do pay for abortions through Medicaid. And we discovered that about 60% of the time when women come into an emergency room with a complication of the abortion, about 60% of the time it's miscoded as a miscarriage complication. So even those who want to look for complications are not going to be able to find them because of the coding deficiencies.
And we can certainly rest assured they're not going to bend over backwards to try to get information collected now. They're going to try to keep this under the cover of darkness as much as possible. Dr. Skop,
that's what they depend on is the American public are ignorant about the fact that we really cannot track complications.
Yeah, you're absolutely right. Dr. Skop, always great to talk to you. Thanks so much for joining us today.
Thank you, Tony.